Can you masturbate, even if you're 60 years old? Today, we're addressing a topic that has raised concerns and confusion among many men: masturbation. Is it harmful? Does it cause erectile dysfunction? Can it lead to balding or lower testosterone and energy levels? These are genuine questions, and if you've ever wondered about them, you're not alone. I'm Dr. Samira Das, a board-certified urologist and a specialist in male sexual health. In this video, I'm going to share the medically accurate truth about masturbation, separating scientific facts from widespread misinformation. Let me start by making something very clear. Masturbation, in and of itself, is not harmful. Despite the myths circulating on social media and within certain cultural narratives, masturbation does not reduce your testosterone levels, it does not cause hair loss, and it certainly does not drain your body of vital energy. These ideas are based on fear and folklore, not science. As a physician, I can assure you that engaging in masturbation is a normal and healthy human behavior, especially when it is practiced in moderation and without distress. Now, before we move deeper, I want to emphasize something important. While masturbation is not harmful, the social stigma and false beliefs surrounding it can lead to significant psychological stress. Unfortunately, social media platforms have become breeding grounds for misinformation, and one of the emerging consequences is the global spread of something known in medical literature as Dhat Syndrome. Now, this is something those AI-generated content won't tell you, because this information comes by spending weeks or even months doing research, just to provide you the best and authentic knowledge. So, what is Dhat Syndrome? Originally identified in South Asia, Dhat Syndrome is a culture-bound psychosomatic disorder characterized by intense anxiety over the loss of semen. Men affected by this condition often believe that the release of semen, whether through masturbation, nocturnal emissions, or sexual intercourse, results in fatigue, weakness, and mental decline. This belief is rooted in ancient Ayurvedic thought, which considered semen a life-giving fluid, the loss of which equates to loss of strength and vitality. However, with the rise of online communities promoting semen retention and NoFap ideologies, these same fears are now emerging in Western cultures as well. While these movements may have started with intentions of promoting self-control and discipline, they've increasingly spread inaccurate claims, suggesting that ejaculation leads to physical and psychological deterioration. Let me be absolutely clear. There is no scientific evidence to support the notion that losing semen is harmful to your health. Semen is made up primarily of water, proteins, enzymes, and trace minerals like zinc and magnesium. When you ejaculate, your body simply utilizes a small amount of these nutrients, nothing more than it uses during other normal bodily functions. The male body is fully equipped to regenerate semen efficiently and continuously. It's a renewable process, not a finite resource. So, what about testosterone? Does ejaculation lower testosterone levels? The answer is no, not in any meaningful or lasting way. Some studies have shown that short-term abstinence can cause a slight temporary increase in testosterone levels. However, this fluctuation is minimal and has no measurable impact on strength, muscle mass, or sexual performance. On the contrary, long-term abstinence may increase irritability, stress, and even depression in some men. This is because sexual release plays a role in mood regulation and stress relief for many individuals. The belief that avoiding ejaculation can enhance athletic performance or increase productivity is not supported by robust scientific data. These ideas often stem from anecdotal reports and internet forums, not from controlled clinical studies. Relying on such claims can lead to psychological distress and unhealthy sexual behaviors. And this brings us back to Dhat Syndrome. The real danger in Dhat Syndrome is not the physical loss of semen, it's the anxiety and fear surrounding it. Men who internalize the belief that ejaculation is harmful can begin to experience real, distressing symptoms, fatigue, low energy, depression, and even somatic pain. But these symptoms are psychosomatic, meaning they arise from mental and emotional stress, not from any true physical deficiency. This condition is a classic example of somatization, where psychological distress manifests in the body as physical symptoms. If masturbation starts to interfere with your daily functioning, your work, your relationships, your ability to engage socially, it's time to seek help. Also, if it involves unsafe practices, it can lead to physical harm. In such cases, it's no longer about the act itself, but about how it's being integrated or misused within your life. If you've been feeling unmotivated, fatigued, or emotionally low, it's essential to look at the real root causes: your sleep patterns, nutrition, activity level, stress management, and emotional well-being. These factors have far more influence on your health than the occasional act of masturbation ever will. As a physician, my goal is not to offer judgment, but to guide you with compassion and evidence-based information. Masturbation is a natural and common part of human sexuality. When practiced in a balanced and mindful way, it does not threaten your physical or mental health. However, if you find yourself deeply anxious or distressed about your sexual behaviors, or you feel trapped in guilt or fear, I encourage you to speak with a qualified healthcare provider or mental health professional. There is no shame in seeking help, and there is always a path toward better understanding and self-care. Thank you for joining me today. I hope this video has brought you clarity, reassurance, and the confidence to make informed decisions about your sexual health. Remember, your body is resilient, and with the right knowledge, you can take full control of your well-being, free from fear and misinformation. Take care of yourself, and I'll see you in the next video.